Deputy Jones, thank you.
May I proceed, Your Honor?
Sure.
Mr. Blount, please take a look at pupils number 22. It's on the projection screen. Does this photo permit you to show us where you were located when you were rendering aid to Mr. Jackson?
Yes, ma'am.
There's a pointer to your right. If you'll use that laser pointer to show the jury where you were located, please.
Here, ma'am.
May the record reflect the witnesses indicating the area on the carpet at the foot of the bed near the area that has been designated as the far side of the bed in front of the red chair located on the left.
Yes.
Mr. Blount, at some point during the resuscitation efforts for Mr. Jackson, you were located in that area in front of that second red chair, the red chair to the left?
Yes, ma'am.
Did you see anything unusual on the floor when you were in that area assisting Mr. Jackson?
Yes, ma'am.
Describe what you saw, please.
Saw 3 open vials of lidocaine.
Where were those opened bottles of lidocaine located?
On the floor, ma'am.
Could you show us?
Yes, ma'am.
May the record...
There's 2 in this area here and 1 far over by the oxygen tank, ma'am.
May the record reflect the witness has first indicated 2 here, and that would be closest to the corner of the bed. Let me ask a follow-up. Mr. Blount, were those 2 bottles of open lidocaine that you indicated on the carpet area or the wooden floor area?
Wooden floor area.
And the 3rd bottle of lidocaine that you described that you observed as closer to the oxygen tank, would that vial be on the wooden portion of the floor or the carpet?
On the carpet, ma'am.
What is lidocaine?
It's an antiarrhythmic drug. It's a heart drug, ma'am.
Did the paramedics administer any lidocaine to Mr. Jackson during the resuscitative efforts?
No, ma'am.
Do paramedics even carry lidocaine with their resuscitative medications?
No, ma'am.
And you told us that you heard Dr. Murray being questioned by paramedic Seneff in his effort to obtain information. Did you ever hear paramedic Seneff, did you ever hear Conrad Murray state that he had given Michael Jackson any lidocaine?
No, ma'am.
Did you ever hear Dr. Murray state that he had given Mr. Jackson propofol?
No, ma'am.
Did you hear Dr. Murray provide information regarding any medications that he had given Mr. Jackson?
No, ma'am.
At some point during your resuscitative efforts, did someone indicate they felt a pulse on Mr. Jackson?
No, ma'am.
Did you ever hear Conrad Murray indicate that he felt a pulse?
No, ma'am.
Do you recall testifying at the preliminary hearing that you heard Conrad Murray say he felt a pulse in the femoral region, and at that point you made an observation of a medical device located on Mr. Jackson's body?
Yes, ma'am.
Does that refresh your recollection?
Yes, ma'am.
What did you hear Conrad Murray say in relation to feeling a pulse?
He was down in the groin area of Michael Jackson, and he said he felt a pulse.
At the time that Dr. Murray stated that he felt a pulse in Mr. Jackson's groin region, what medical activities were taking place?
I'm sorry?
What resuscitative efforts were taking place? For example, were chest compressions being conducted on Mr. Jackson at the time that the defendant stated he felt a femoral pulse?
Yes, ma'am.
And in response to Dr. Murray indicating he felt a pulse, did compression stop for a moment?
Yes, ma'am.
Why would that be important to do?
It's important to see if the patient has a pulse on his own, or are we giving him an artificial pulse, ma'am?
Compressions can create blood flow through the body and thereby create an artificial pulse?
Yes, ma'am.
Once compression stopped, did others check for verification to see if they felt a pulse?
Yes. Yes, ma'am.
Was there any indication that anyone else felt a pulse?
No.
May I just have a moment, Your Honor?
Sure.
Mr. Blount, at the time that the resuscitation efforts were being carried out, was paramedic Seneff speaking to UCLA base station and communicating information concerning Mr. Jackson's condition?
Yes, ma'am.
At approximately 12:57 p.m., did you hear UCLA base station advise your team that further efforts would be futile and that they were prepared to call time of death?
Yes, ma'am.
Did you have any reason to believe at that point in time that Mr. Jackson was alive?
No, ma'am.
At any time when you were in Mr. Jackson's presence, did you see any signs of life?
No, ma'am.
After UCLA indicated that they were prepared to call time of death, Dr. Murray requested to assume control of the patient. Is that accurate?
Yes, ma'am.
And shortly thereafter, was Mr. Jackson prepared for transport from the Carrollwood residence to UCLA Hospital?
Yes, ma'am.
To facilitate that transport, was Mr. Jackson placed on a backboard?
Yes, ma'am.
At the time that he was placed on the backboard, was he then taken downstairs?
Yes, ma'am.
Did all of the paramedics take him downstairs?
Yes, we did.
Prior to Mr. Jackson being transported downstairs, did you see Dr. Murray do anything with those lidocaine bottles that you had previously testified to us you saw on the floor near the bed in Exhibit 22?
Yes, ma'am.
Tell me what you saw Dr. Murray do with those lidocaine bottles, please.
He scooped all three of them up and put them into a black bag.
Where was that black bag located when Dr. Murray placed those lidocaine bottles inside?
I'm not sure. It just showed up. I don't know where he got it from.
Where was Conrad Murray located when you saw him scoop up those lidocaine bottles and put them in a black bag? Are you able to show
yes,
us
I can show
on,
you.
on
Yes,
Exhibit number 22?
After he got Mr. Jackson all loaded up to go, Mr. Murray was off in this area here.
I'm sorry, Your Honor, may I request the lights be dimmed, please?
Please.
Thank you. Mr. Blount, will you proceed with your explanation again, please?
Once we got Mr. Jackson loaded up to take him to the hospital, Mr. Murray was off in this area here.
May the record reflect the witnesses indicating the wood floor area on what's been designated as the far side of the bed, in between the TV located on the floor and the red chair that's to the left.
Fair statement?
Sorry.
Is that a fair statement?
Yes, ma'am. Yes, sir. Sorry.
All right. Thank you.
Did you ever see those lidocaine bottles again?
No, ma'am.
And of course, you were preparing and the others were preparing to take Mr. Jackson down the stairs so he could be transported to the hospital, correct?
Yes, ma'am.
During transport to UCLA, did you ride in the rescue ambulance with Mr. Jackson?
Yes, I did.
Where were you situated relative to Mr. Jackson's location?
Towards the head.
Were there further resuscitative efforts, including any additional starter drugs administered to Mr. Jackson during transport from Carrollwood to UCLA?
Yes, ma'am.
Was there any change in your observation, either by viewing a monitor or your own observations of Mr. Jackson's physical condition during the time of transport to UCLA?
No, ma'am.
Did you, inside the rescue ambulance, did you see Dr. Murray engage in any activity that did not appear to have anything to do with medical treatment to Michael Jackson?
Yes, ma'am.
What did you see Dr. Murray do?
He was on the phone, ma'am.
Could you see him speaking on the phone?
Yes, ma'am.
Could you hear what he was saying?
Briefly, yes.
What did you hear him say?
He said he said it's about Michael, and it doesn't look good.
You don't know to whom he was speaking, do you?
No, ma'am.
May I have a moment?
You may.
Your Honor, I have a few more questions. Mr. Blount, you indicated that you saw Dr. Murray touching the groin area of Mr. Jackson when he indicated he felt a femoral pulse, correct?
Yes, ma'am.
Did you see anything on Mr. Jackson's body at that point in time?
Yes, ma'am.
Describe what you saw, please.
So Jackson had on a condom catheter, ma'am.
Describe for us, please, what a condom catheter is and what its purpose is.
Yes, ma'am. It's like a condom with a long tube on it.
And its purpose?
When the patient urinates, it's collected into a bag.
Is it typically used when someone isn't capable of getting up to go to the bathroom on their own?
Yes, ma'am.
And in terms of the statements that you heard in response to paramedic Sinif's questioning, did you hear paramedic Sinif ask Dr. Conrad Murray how long the patient had been down when you arrived?
Yes, ma'am.
What did you hear Conrad Murray respond to that question?
He said he's been down for about 1 minute.
Your observations and assessments of Mr. Jackson when you were providing basic life support and advanced life support, creating breath and airway for him, did you also observe the relative temperature of his skin?
Yes, ma'am.
Describe what it was, please.
It was warm because he was in the bed, so it was warm.
When he was on the floor and you were providing care to him, was his skin cool to the touch?
Yes, it was cool, yes.
And you described for us the other observations you made regarding his eyes being fixed and dilated and no heart activity once he was hooked up to the monitor immediately after your arrival. Did those observations of his physical condition and his heart monitor activity comport with your hearing the information that Mr. Jackson had only been down for 1 minute prior to your arrival?
Yes.
That made sense to you?
No, it did not.
How was it contradictory to your view?
With his condition and the way he was, it's like he'd been down longer than 1 minute.
So the information that he'd been down for 1 minute, in your view and your assessment and your medical experience, was incorrect. Is that accurate?
Yes, ma'am.
Thank you. I have nothing further.
Thank you. Ladies and gentlemen, we are going to take the mid-afternoon break a little early. I know you're looking at the clock. We have some matter to discuss. It's not going to take all that long. So we're going to take a mid-afternoon break. It'll be at least 15 minutes, maybe about 20. Please remember all the admonitions and instructions, both in writing and verbally. And please take your break in the jury room, and we'll be back with you in about 15 or 20 minutes.